In this morning's Health Watch, your sense of smell. It is one of the most important senses, and at least half of us lose it at some point in our lives, even if only for a short time. Well, now there's a new study which finds many Americans who lose that sense of smell simply deal with it rather than seeking treatment. But boy, what a difference treatment can make. Dr. Liberatore is an ear, nose, and throat specialist from New York's Lenox Hill Hospital. She's here with us this morning along with Jennifer Rhodes, a patient who lost her sense of smell and decided to get help. Good to have both of you with us.
Thank you. Thank you.
Doctor, give us an idea. As many as half of Americans will lose their sense of smell at some point, even if it doesn't last. Why do people not seek treatment for this? It affects everything, your taste.
Right. Well, I think most of the time people don't realize it because it happens gradually. And we have basically two organs, two nerves that allow us to smell. So if you can smell on one side and that gets used to a certain point, it's not until you lose the nerve on the other side in which you realize that you can't smell at all.
That people start to realize. Jennifer, what was it like for you? Were you to the point where you had absolutely no sense of smell?
It was, yes, there was no sense of smell. And when I lost my sense of smell, I also couldn't taste things as well either.
So what made you decide that, you know, maybe there is some hope for me, maybe I can actually do something about it?
Right. Well, speaking with Dr. Liberatore, we had done everything non-invasive, non-surgical, before we actually decided on surgery. And that was the last, decision.
And the surgery was pretty quick.
It was very quick. I went in on a Thursday and I was back to work on Monday.
What happened after the surgery? How long did it take for your smell to come back?
It was instant. When I got home, I had a peanut butter and jelly sandwich, and it was the most amazing peanut butter and jelly sandwich I ever had.
Who knew peanut butter and jelly could taste so good?
Exactly.
Doctor, so Jennifer ended up having surgery, but she mentioned you guys tried a bunch of things before you get to that point.
Right.
Even though this is a sort of non-invasive surgery, as surgeries go, are there other things people can try?
Well, I think the most important thing is to try to find the reason, because this was one of the causes, and of course one of the more common conditions that I treat, which is patients can't smell because their nose is congested, they have allergies, they have polyps in their nose, and the odors or the molecules can't get to the organ of smell. So I think the most important thing is figuring out what do you think the problem is first.
And those are the main causes, the ones that you went through: congestion, allergies.
Right, viral infections, a cold. You could have injured your head, had head trauma.
Right.
That's a common cause. The nasal conditions, which we talked about.
Could it ever be something environmental?
Sure. Anything which you breathe in, which can then irritate those nerves in the roof of the nose, can cause a decrease in smell. So there's certain occupations that we know are definitely
Construction
problem.
probably is a great
Construction,
example.
people who work with leather, working formaldehyde, anything where they're breathing in toxins, which go right into the nose. Cleaning people who work with toxic cleaning products, that's a common problem.
So then once you figure it out, once you identify the cause of it, that's when you start to talk about treatment. Obviously, I would imagine eliminating some of those triggers is a good idea.
Exactly. Just sometimes using simple saltwater solution. Just telling the patient when you get home from work, why don't you try to irrigate your nose with a neti pot or saline solution, or wear a mask, or make sure you have proper ventilation. Hair colorists, people who color hair, they're very often not in a situation where they're getting good ventilation.
If someone does decide that ultimately surgery is what they need, we talked about how it came back pretty much instantaneously for you. This is an outpatient procedure?
It's an outpatient procedure, right? Patients, it's not a painful procedure. The patient doesn't look any different after surgery.
Is it more common now? Are people turning to surgery more?
I think because we have minimally invasive techniques, so the surgery doesn't seem as problematic in terms of getting back to work, and the post-op pain is much less. I think you're seeing patients less scared, and of course there's more information for patients to have about the surgery, so there's less misconceptions about how it was.
And Jennifer, obviously you're a great advocate for it because we know how happy you were with it. For people though who think maybe this is not the route I want to go, if you don't treat that loss of your sense of smell, could it become permanent?
Yeah, I find that the longer the patient has not had a sense of smell, the less favorable the recovery is. So if somebody's had years and years of polyps, infections, trauma, all those trauma to that sense of smell, then there's a less favorable chance of recovery.
So if you have an issue, get in there now.
Right.
Is the headline. Great to have both of you with us. Thanks for coming in this morning.
Thank you.